Happy Friday, everybody. It's Dr. Tucker at Tucker Chiropractic Center, and just wanted to share a little bit about cortisone injections. Obviously, in our office, we see a lot of people come in with neck pain, shoulder pain, and we're always looking for ways to manage pain. And there's going to be a time and a place for everything: natural care, chemical care. The question is the management right, and does the patient understand the side effects potentially? So first thing I want to touch on, just two quick points. Number one is that the injections really are limited to only a few a year because there are risks. One of which is if you get too much cortisone into the joint, it can eat away at the joint. It can demineralize the bone. So it doesn't just eat away at the inflammation, it actually eats away at the bone. So it can demineralize the joint itself, which means you're going to be more susceptible to fracture down the road. So hopefully you're not getting them every few weeks or months. You really need to be really cautious with how many you get. Second point, where and when is the right time or place? So there are some considerations. A lot of times I think what's overlooked is referred pain. So for example, someone has left shoulder pain and you check their range of motion. I saw this with a patient this week, and that's what made me spark this thought for the video. Their shoulder hurts, yet they had pretty good shoulder range of motion. However, when you check their neck, there was a lot of restriction going left. When I started poking around at the bottom nerve roots that control the shoulder as the brain sends electric signals down to there was a blockage, interference. The joint was jammed, the patient was pinching the nerve every time they'd pivot that way, and it would refer to the shoulder. So in that particular patient's case, there's really not a lot going on the shoulder to touch, to movement. It seems like most of the pain was coming from the neck. So if you're getting injections in the shoulder, you've got to battle the natural versus chemical route. That's a consideration. The second consideration is I don't think they were having proper management of their cervical spine. Very confident that shortly that patient will start responding favorably by treating their neck area. So a couple thoughts as it relates to shots. Any questions, feel free to comment. Thanks.